There's a member of Congress whose father is a pathologist, and he spoke to a CAP council. And it's time for laboratories to renew their proficiency testing programs. Coming up next on the Path News Network. Welcome to the Path News Network Daily Edition, powered by the College of American Pathologists. Today is Tuesday, October 28th. I'm Brittany Riddle with the latest news. The CAP's Council on Government and Professional Affairs recently held its fall assembly meeting in Washington, D.C. Committee members heard from several guest speakers, including Representative Jay Obernolte, whose father is a pathologist. He spoke about the need for oversight of artificial intelligence in healthcare. He also answered questions about congressional support to stop Medicare cuts to lab services in 2026. CAP members act now on the Medicare cuts and other critical issues affecting pathologists and laboratory medicine. Make your voices heard by using the CAP Action Center to contact your member of Congress directly. CAP member Dr. Eric Wargotz was just inaugurated as the 178th president of the Maryland State Medical Society. Dr. Wargotz is the senior staff pathologist at Luminous Health Doctors Community Medical Center in Lanham, Maryland. He's also a clinical professor emeritus at the George Washington University School of Medicine and Health Sciences. Among his goals as the newly elected president is to advance preventive medicine and public health. Finally, order renewal is the annual period when laboratories renew their participation in CAP proficiency testing programs for the coming year. Joining me today to explain the impact of some new microbiology programs is Dr. Benjamin Bradley, a member of the CAP's Microbiology Committee. Dr. Bradley, welcome to Path News. You mentioned the dengue virus, which has been a trending topic globally this year in the news, and there's a new dengue virus program being offered. Can you tell us more about this exciting program and how it addresses a growing public and clinical health need?
Dengue virus is a mosquito-borne infectious disease, and its kind of colloquial name in the medical literature is breakbone fever. And that really just highlights kind of how painful this condition is. It causes really bad joint pain, muscle pain, things like that. Folks can get really, really sick from this. And, historically, these dengue virus was kind of limited to certain geographic areas. But what we've started to see over time is that area where dengue can be continue to expand. And so we've actually had cases in the U.S. that we've seen now of local transmission events. But primarily, this is something that kind of happens in travelers where they may go to an endemic region, come back, and then start developing signs and symptoms. And in these situations of travelers who return with a fever, there's a very broad differential diagnosis you have to maintain, with dengue virus being one of them. So for labs to bring on dengue virus testing, to be able to identify this earlier, that can help clinicians get a sense of what they're dealing with. That might limit the number of additional tests they need to order, or maybe that would stop a physician from giving this patient unnecessary antibiotics or something like that along the way. So that's kind of really the big kind of impact of having this dengue virus serology available now in the labs.
You're a member of the CAP's Microbiology Committee. What role does the committee play in identifying and developing new PT programs like these?
Yeah, so, fortunately, it's a group of a lot of really great scientists and physicians. And we kind of try to anticipate sort of what emerging needs are. So sometimes it's because maybe some new technologies have come out, whether that's, molecular assays or serology assays that labs are starting to bring on. And we say, okay, there's kind of a critical mass here of testing that's available in the US or internationally. And we want to make sure that these labs are doing a good job with their testing, knowing that their testing is performing how it should be, and being able to compare that to their peers. So that's really what motivates us to bring on these PT programs. And for me in particular, something that I'm really interested in is kind of the role that clinical microbiology labs can play in public health and responding to emerging infectious diseases as well.
So, looking ahead, how do you see the evolution of PT programs shaping the future of microbiology testing and laboratory standards?
You know, with PT material, it really is kind of a two-way street. Obviously, we send this material to labs to make sure that their policies and practices are in line, that they're getting detected results when it needs to be detected, or getting, if we're doing viral load testing, a viral load that's in that needed region. But there's also a flow of information back from the participants to the CAP where we can say, okay, let's get a sense of sort of what testing capacity exists in the US or internationally for identifying this pathogen, and what kind of platforms are being used. Are we seeing any differences between platforms or performance changes that might indicate maybe an assay needs to be updated or something like that? So, kind of going back to the SARS-CoV-2 example, that virus was mutating a lot very early on when it was emerging, and there were some assays that were having target failures to detect it because of the mutations in the virus. And so if we're sending out PT material, we can start to see maybe if there's a manufacturer or an assay or something that's dropping off or changing in a way that we're not suspecting. And so that helps us to kind of understand the epidemiology of these viruses that changes, and helps us kind of work with laboratories, work with manufacturers to say, do we need to be making changes to these assays as well to adapt for the viruses as they change?
Thank you again to my guest, Dr. Bradley, for joining me for today's edition. Find more on proficiency testing and all of today's stories in the show notes and our member newsletters on Tuesdays and Thursdays. We're back tomorrow at 5 a.m. Eastern Time. I'm Brittany Riddle. Have a great day.